You can tell.
It's very good.
You ready? We can start?
Yes.
Assalamu alaikum. Alhamdulillah. We have completed around 500 cases of coronary interventions in Gargaar Hospital, Somaliland. Alhamdulillah, we have done a range of patients which included simple heart attack to patients with complex coronary problem with including pacemakers. We have closed the holes of more than 15 children, and we have done angioplasty of the lower limb vessels. So Alhamdulillah, we are very much happy that even with Corona, our department is functioning. We have a good team of cardiologists and supportive staff from India, and also Somali people, Somali doctors and Somali nursing staff has joined us. And Alhamdulillah, even during this time we were of some use to the society of whole of Somalia. So we hope that the more the patients come to know and more they take treatment on time, we can give better results. Now what we are seeing is patients getting heart attack, they are coming little late, so that when we do the angiogram, angioplasty, everything, it takes some time for some benefits, some will not get that best benefit. So the earlier they come, the earlier we can give the better treatment. Inshallah, with the good team, I hope, inshallah, more and more people will benefit. One of the biggest thing what we feel we have provided is, one is we have been able to provide a good quality care at a reasonable cost to the people of Somalia, especially at this time of this lockdown where they could not go out for treatment. Second, the most important thing are just doing angioplasty or pacemaker is not enough. After that you have to follow up the patient. Alhamdulillah, we have been able to follow up the patient regularly and make sure and educate the patient that they take the medicines correctly and they take the necessary step to prevent the disease from occurring again. With this, I'll give the mic to my senior colleague and the leading cardiologist of Somalia, Dr. Muhammad Hassan.
Thank you.